You're watching Conscious TV, and I'm Alex Howard. And my guest in the studio today is Anna Dushinsky. Anna's the Director of Psychology at the Optimum Health Clinic in London. And today we're going to be talking about the role of psychology in ME, chronic fatigue, fibromyalgia, and that whole group of different illnesses. But Anna, before we come into psychology and ME in that area, maybe you can start off by telling us a little bit about your background and how you got to working in this area.
Yeah, sure. Well, I guess the quick answer is I work in the area primarily because I myself had chronic fatigue or ME some years ago now. I was about 14 when I got glandular fever from a boyfriend who had it about 2 weeks. I never quite forgave him when I had it for about 10 years. And from that point onwards, really, I just, through my whole teenage years, really, kept getting ill. So I had tonsillitis every couple of weeks, was taking lots of antibiotics. No one was really mentioning CFS or ME, but I was really constantly ill through that whole period.
So you were kind of going to school, struggling to keep up and going down with colds and flus and that kind of thing.
Exactly that, and missing bits of school, certainly missing a lot of the social time. I became kind of notorious for not getting to any of the parties that I was invited to, which was not a reputation I much wanted. And yeah, just finding it really tough, and particularly as it went on, kind of getting to GCSE and then to A levels, I was increasingly missing school and missing periods of time. So yeah, not much fun, but really had no idea what was happening. Kept going to the doctors, but just being told, well, it's glandular fever again. Just recurrence of the same thing.
Which must have been incredibly challenging. That you know at that age especially, you're used to, you go to the doctor, you get a pill, and you get better. What was the point where things on your own kind of healing journey started to turn around?
Well, I guess they got a lot worse before they got better for me. So I made it to university, but very quickly began to get a lot worse. Decided that I was unfit, so I took up rowing, which was probably not the best idea. Got up at 5 a.m. in the morning and decided to go rowing. So quite quickly really crashed quite severely and spent about a year asleep. And that was the year where I decided there was definitely something going on. I needed to look at that. So I really, realising that the doctors were just offering antidepressants, but essentially telling me to go home and sleep. And age 19, I decided that should not be my life.
Right.
I started to, I suppose, take it into my own hands. Because as you say, the tendency was to assume that you go to a doctor and they'd tell you what to do and they'd fix it for you. And they weren't. So I started to read around the subject, read a lot around nutrition, around health, around psychology. And I started to piece together the jigsaw puzzle, if you like, to get a sense of what it is that was really going on for me. I guess that was really the point after that really bad year that I started to turn things around. It took a little time for me to get to the point where I fully recovered because I was pretty much making it up as I go along. And I guess that was a big part of the motivation to continue to work in this area, that it doesn't have to be that difficult. And it was a struggle for me.
Yeah, and obviously we'll talk about psychology in the interview today, but it must have been quite a difficult thing at that point to embrace the idea that your psychology and your thoughts were causing this very physical situation you were in. How did you kind of come around to that inside of yourself?
It's a good question, and I really relate to my patients now when they say that, initially when they think of psychology being a factor, they kind of want to hit someone, because the idea that we have with that is that we're making it up. And that's really tough when you've been through years often of feeling really physically ill. You can't walk to the supermarket, you can't do all the normal things in life. That feels really physical. I think it was just reading a lot around the subject and beginning to understand that my concept of almost the Cartesian break between head and body, that, you had your mind and then you had your body and these two things were separate, wasn't really true, and that the way that you're thinking, the way that you're feeling emotionally massively impacts the way that you feel physically as well. So that, I think, just bit by bit began to eke into my consciousness. So I started to think differently and feel differently about it, yeah.
And so with the transition of kind of your own journey and then coming to work with others, talk a little bit about that kind of transition and kind of getting more and more interested in this field and the different tools, because psychology is a big term, and there's a lot of kind of things that are part of that.
Sure. I guess, I'd never considered being involved in this area at all prior to that. I was doing French and Italian at university when I got out.
Okay. Rather a different...
Slightly different.
Direction.
Still communication as you look back on it, but not the same at all. And I think it really was the recognition of how much it had helped me, and then realising that where I'd been fairly lost up until that point in terms of what I really wanted, I was just kind of on the treadmill. So I did my GCSEs and did pretty well, did my A-levels and went to university. without really any idea of where I was going in my life. And ME, in a way, was a gift. Easy to say in hindsight, I know, that you could step back and review your life and who you were. So I realised that what was really interesting to me was psychology and how people worked and how the mind and body impacted each other. The tools I chose to train in are very much the sort of brief therapy end of things. So very much the practical and solution-focused ways of looking at psychology and behaviour. And that's because that's what made the biggest impact on me, I think. So things like NLP, which neuro-linguistic programming, which I'm sure you've talked about a little bit and we'll go on to talk about a bit. And those kinds of tools seem to me to make the most difference. And yeah, it was a really interesting transition. I trained in all of this because I was fascinated. Had an idea that it would be good to work with people who'd been ill, but really had no idea if I could until some sort of friends of friends started to come out of the woodwork, as happens very often with things like CFS, and said, well, you've recovered and you've trained in this stuff. Can you help? And I went, I have no idea. So we spent about a year working really pro bono with increasing numbers of people, and kind of got to the end of sort of 6-9 months, reviewed and went, oh, they're all getting better. There must be something in this. So that's the point I really turned that around and began to think about this seriously as something I could work with.
And interestingly, also, you talked about kind of brief therapies and that kind of thing. You also mentioned that on the psychology side, it doesn't mean that someone's just making it up. And maybe it's worth talking a bit about the difference between the conscious and the unconscious, and how just because someone had a mind-body component doesn't mean that they're crazy or they're making it up.
Not at all. As I think we're going to go on to talk about more, the connection between the mind and the body are really very real physical factors. If you're in stress, the way that so psychologically and emotionally in stress, the way that impacts your physical body is extraordinarily real and chemical. It makes significant chemical changes to what's going on in your body. So whereas we might say that we're making it up or it's all in the mind, that, and in fact there's entire branches of science now looking into this as a concept, but that really is a very outdated way of thinking. So absolutely not. The fact that we're looking at psychology is really to look at how we can take control of what's happening in our physiology, in our physical body. And that's just a massive factor in this kind of illness. And
that's also quite different, I think, to how a lot of people maybe see it. There's been talk about the role of genetics and that kind of thing. What are your thoughts around that?
Yeah, I mean, if we're talking about sort of illnesses like chronic fatigue and that whole section of illnesses, we know that there has got to be a genetic component, without doubt, because otherwise, why did you and in fact me get ME as opposed to something else? And in fact, we all know people who really should have burnt out by this point because they're driving themselves, they're pushing themselves all the time, but they're not. So there must be genetic components underlying why we choose physiologically to express this through ME or through something else. But even in illnesses like breast cancer, which we know to be sort of significantly genetic, I think the stats I read recently is it's around sort of 5%, I think, for breast cancer, which is very, very low, actually, if you think about it, and lower than most people would expect. So I think the key thing to realise is, yes, there's a genetic component, but genetics don't dictate what happens. It's the genetics plus all of the lifestyle factors, all of the triggers that go on top of that, which dictate whether or not you get ME or CFS or you don't. So it's a factor, but I don't think, personally anyway, that it's the answer. It just gives us more information.